Yes, welcome to today's class. We have finished all our anatomy, physiology, most of the major the functioning of our body. Now, all allied sciences, like Vibrionics is not a small thing. Many practices, I can say many therapies can be practiced through Vibrionics. What all the, for example, what all the things can be practiced through Vibrionics? Batch flower remedies, biochemistry, electrohomeopathy, we have derived the rate. That also we can practice. Homeopathy we can practice. Pranic healing like things we can practice. And the gem therapy can also be practiced. Again, batch flower remedies, again, flower remedies and like mantra therapies, Tibetan psychological drugs we can do, color therapy, and even so many acupuncture, I forgot to tell you. Fantastically, there are so many field we know that is open with the vibronic therapy. So we have to know little bit of those things because we are putting the seed today, and it will, I'm expecting that it will become a very big tree and give shelter to so many people. Different approach. Why? Because uh, when I was around 10, 15, 20, 25 years ago, I used to learn many things. Many things. I learned so many things. Like neurotherapy, I learned. And as it is, as a acupuncture up to the senior level, so advanced level, everything. And pranic healing, Reiki healing masters in from 2000. So like that, there are so many things, I learned. And people in my home, my father was very much confused. ये बेटा क्या कर रहा है ये तो समझ में नहीं आ रहा है. Sometime he says he's learning Reiki. Sometime he's more into homeopathy. He's digging his whole life into homeopathy and bath flower remedy. So many things he's learning. And what all this preparation was for the today's Vibronics, because through Vibronics we can practice many therapies. So now different techniques in the prescribing. That is very interesting and very important. So first we will start from the easiest one. I have already given you the biochemic things, Biochemic has only 12 remedies, and I given you all the PDFs. And start one by one, and you try this one, or you can say have a dowsing like thing. What therapy should I use for this particular person, for this particular patient? Gem therapy and electrohomeopathy, we will take it on this Sunday. Electrohomeopathy is very complete. It is a complete system. I will talk more about when I am speaking about the electrohomeopathy. Okay, so different today's technique is, because I requested one of our senior homeopath, but he generally seems to be very busy. So he's from Pune, he's very busy. Also, he has got some health issues, and we are unable to connect him. And if possible, we will call him as a guest lecture, and we will explore many things about what I am going to tell you today. And I have already shared a book in the group that is very important. This is a different technique. This technique is especially just keep on talking to the patient and entertain a patient. Entertain means don't stop when he is talking about the symptoms. Welcome everything and be a very good listener. Become a very good listener and listen and try to extract what his inner spirit is telling. And Next, coming forward, we will take the Shankaran's method. Shankaran's method by listening to a talk, or I can say by just taking case taking itself, we will be able to classify whether he belongs to plant remedies kingdom, plant kingdom remedy, or mineral or the animal. Plant, mineral, or animal. We can easily classify and try to look into it. When you are going to the Vishwambar Das, then you see if something is an animal like behavior. I will tell you regarding that. That will also be one of the. Namaskar. Very good. Sri Jai Sri Ram. Very important today because my aim, my ambition is, within 3 months, all you should become the expert homeopaths.
Yes, sir.
So by using Vibrionics, we will be able to help many people. Like, there is no limit to the, knowledge. Knowledge is it is always available in many ways. So today's the method of prescribing is by SEHGAL method. Okay. SEHGAL, those are the very, I was fortunate to take the direct lecture from the SEHGAL, both the son. I went to Mumbai for taking that classes and very fortunate. And we have around so many books available, SEHGAL method. If you go, I think the PDFs are also available. See if it can available in the group. And if you want to study, because you have already entered a ocean of knowledge, but we are restricting ourselves to some part of it. So we will teach you how to swim, how to ship, how to fly, and that is how you can choose your own way. Now today, the SEHGAL's method. SEHGAL's method, I have already shared the book. How you should start the case taking. And while case taking, whatever the answer you get, based on that, you can identify the medicine, which is talking in between. From the soul. What we people call in homeopaths, what they call, we don't identify a patient. We don't, name a patient by his name. No, we name a patient by the remedy. We will come to this. This is a very beautiful thing. And I know you try to, this is because one of the biggest advantages that the remedies are very less. I think maximum 35 remedies or even less than a remedy. And somehow you will come across such people in your practice, and you will be able to prescribe these remedies. Okay. Now, so we start our this thing. What generally when someone comes to you, you can ask, what is the problem? So they will say, so and so is my problem. Okay. From how long you are suffering? How long you are suffering? They will tell this many days. Have you taken any medicine? If you are asking, they will say there are so many questions. There is one software also that is SEHGAL software, that is I'm using. There they say that no, I have not. Then what do you think? Let them ask, okay, then you have the next question is, why don't you take the medicine? Then he will say laughingly, no particular reason. You will come across such people. When you come across such people, suddenly your attention go to that remedy. I will tell you, it is very interesting because it is one of the most interesting topic in this total session. Okay. Laughing and speaking when. So how do you differentiate the rubric? Rubric means the symptom which is available in the repertory is called as a rubric. So laughing while speaking, बोलता है हाँ कोई क्यों भाई कितना दिन क्यों नहीं लिया? हाँ, there is no any reason. Huh? That how this is, how can we divide this particular sentence into three symptoms, that is laughing with no particular reason, laughing speaking when, and frivolous. Frivolous is this tendency. Okay, without laughing no particular reason. if if he says, matlab, if he is not laughing but he's saying there is no any reason, like that, if he's taking lightly, means the person is taking lightly. Further we will find out the what is the meaning of these. Okay, without laughing no particular reason, I didn't bother through, though I knew of the sickness. Okay, बोलेगा मुझे पता है, why you are not taken the medicine, मुझे पता है, still there is no reason why I didn't bother about my problem. I was having sugar, but I didn't bother about my problem. I knew that sickness is with me, but I don't, that is, in such cases, what you have to take, in different कि मेरा problem है, but I did not take. Okay, so indifference is a common symptom. Next, I took some home remedies. Took remedies of my own, and today realized that without medicine it would be difficult to go on. So I have to come to you. So these are the possible answers. They will tell you, ha, I took Karela juice pia, or you can say so many things I took. Then finally I saw my sugar is not under control. I'm just giving an example. Don't take that it is only for sugar. I am going in the same train, so I am talking. Okay. So I took the Karela, I took that, this and that, but still it is not controlling. So I realized without medicine it would be difficult to go on. So I have come to you. In such cases, how we have to divide the symptom? What the symptom we should think about? That is delusion helping call for. Delusion helping call for means he उनका दिमाग में आ गया, मेरे को अभी कुछ खतरा होने वाला है, मेरे को चाहिए, I have to get a remedy. If someone is having that, ये माइंड में आया तो platina, that is a symptom of platina. If someone is telling the similar word, similar thought, अब तक मैं तो ले रहा था लेकिन वो कुछ कंट्रोल नहीं हुआ, then I thought now it is गड़बड़ हो जाएगा, otherwise I will have some problem, so I have come to you. If someone is telling like that, so platina is the remedy. Why you have come to take a medicine today? You are telling, हाँ भाई इतना दिन हो गया तो और भी ऐसे ही रहना था ना, क्यों आया? Why you have come? Then I had come to the city, so I decided to come here. yeah? बोलेगा, जैसे शिवमोगा विजिट किया था, देन आई सोचा श्री राम जी को मिल के आते हैं, वैसे ही मेडिसिन भी लेके आते हैं, है ना? लाइक दैट इफ दे आर टॉकिंग, सो आई हैड कम टू दिस सिटी, सो आई डिसाइडेड कम टू यू. और टुडे माय वाइफ एंड हस्बैंड मदर आस्क्ड मी टू टेक सम मेडिसिन, है ना? कुछ ना कुछ आप मेडिसिन ले लो, मीन्स ही हैज नॉट कम विथ हिज ओन विश, ही इज बीन कंपेल्ड. सो उसका क्या होता है? सो आई हैव कम, तो दैट इज फ्रिवलस, स्टिल ही इज निग्लेक्टिंग हिज हेल्थ. Frivolous is then next. You go through this already, I shared with you. You will come across, I will come across such talks when you are talking to a patient. Tonight the problem increased, so I have come. He may tell also second answer. Why you have come today? My wife and my mother or my some father told me to go. That is first answer, number one. Second answer is, tonight problem has increased, I have come to take medicine. They will tell like that. Fear of एक्स्ट्रा वेजेंस ऑफ मीन्स बढ़ जाएगा, एकदम बढ़ जाएगा करके फियर है, तो इसलिए वो आया। तो लाइक दैट they will fit in one of these answers. Then why did you think taking homeopathic medicine? Huh? Why do you think why you are thinking of taking homeopathic and in our case vibronic medicine? My friend told me that he had recovered, so I thought I would also get cured. Means in he will tell like that na, हाँ they so and so people are no आपसे ठीक हुआ तो वो मुझे भेजा है इसलिए हम आया है। तो in such cases what the what you call the symptoms are, symptom means the concept, the superstitious means he believes on what someone believed. Okay, they believed, they become all right, so he believed them, and so there is a superstitious and naive and credulous. These are the thing which is this is by the he your friend is recovered, and the that's why I am also have come to you. So in such cases, what is a medicine? Medicine is belladonna. Okay, so when did your friend did you tell you? When did your friend tell you? He told me only yesterday. Today I have come to you. Carry desire to be fast. What is the answer? बहुत जल्दी जल्दी करना है, बहुत जल्दी मुझे कुछ हो जाएगा करके he will be in panic. He carried desire to. Again, there is a this symptom is there in belladonna. Okay. He told me few days back. I thought when I would go to bazaar, I would take the medicine laughingly. है ना? He will say he has not come, for medicine only. Many people are there like this, like a negligent about their health. So that is this a symptom. How to take the symptoms as a you can say theme, frivolous, laughing, speaking when. If someone is talking, Dhananjay ji, मैं इधर ही आया था. I know you are. My friend told me you give a very good remedy, vibronic medicine. Please give me. So I have come to the bazaar. I thought I can visit you also. Means you can give belladonna. Just give belladonna and he will become all right. Let him have any damn disease because his internal mind, internal concepts tell like that. This is the theory of the SEHGAL method. This is SEHGAL method based on the mind. Okay. Next, why did you take the homeopathic? Why didn't you take the homeopathic medicine earlier? Huh? So we call that, Vibronic people call this as a advanced homeopathy. I call it advanced homeopathy. Without any hesitation, I call this advanced homeopathy. So why didn't you take the homeopathic earlier? Then answer what will be, I thought it was very slow, whereas allopathy worked very fast. Again, his intention comes here. Carry desire to be fast. Carry desire to be fast is again belladonna. So like that, we will come across why have you come to take the homeopathic medicine today? क्यों भाई आया भाई, इतने दिन के नहीं आया, आज क्यों आया? Okay, you cured me my previous illness. So it was obvious that I should come to you. He has experience of homeopathy on himself. So objective is reasonable. This is concept is objective. Why he has come? It is a reasonable concept. Reasonable. That thought itself is reasonable. The patient is sure of his recovery because he got cured previously, so he is sure that you are going to cure. If you ask him whether is he hopeful of the recovery, he will say in affirmative only. Okay. Then again, you see that remedy changes. If someone they say that yes, last time you cured me, I am sure I will get cured by you, and let him have any damn disease. You give the Nectrum muriaticum. When you don't understand the potency, you can give the 30 potency. So in such cases, you will come across, they will when they keep talking, quietly listen, keep listening, then that picture will come in front of you, that question will come in front of you. Oh, in the term, the similar question was asked by the patient. So, okay, then how's your nature? Do you say? How much do you, how much anger do you feel? Bole say, I feel very anger. What do you do in anger? I throw things to hit things in the anger. Anger throws things away. Throw things at person who offended. This is all called as the SEHGAL. Okay? So when you ask them, no, keep on asking. When as that answers keep on coming, it will show you the some other remedy. Then आपको गुस्सा आता है? बोला बहुत गुस्सा आता है. बोला क्या करते भाई? When you get a anger, what do you do? I throw the things, hit things in anger, or hit things in anger, or anger throws things away. In anger, he throws things away. Throw things at person who is offended. Is the medicine is SEHGAL. So, okay. Next, I become, the second answer is, I become very valuable in anger. I even hit the children. So, do you regret on or not? Yeah, I regret. I do regret. How much time? 5 minutes, 10 minutes, around half an hour or an hour later, I repent immediately after 5 to 10 minutes. Anger alternating with a quick repentance. The repent later after some time, maybe half an hour or even later, after thinking, that is called as the, if you have that tendency, that theme is called as the introspection. You will come across, some remedies will come across this, but you remember what this word means. Okay. Do you like watching TV or listening to songs on the tape recorder, deck or stereo? How much do you like? So I am very fond of watching TV and listening to songs. I remember them and even sing on hearing the tune. Fantastic. Okay. That's fantastic thing. See, if someone start, if a tune is a kahi pe tune baj raha hai, they start singing along with that. That is a wonderful remedy is Krukasatayavam. That means that, music amalgamation. He is very happy with that. Cheerful music from. And singing voluntarily, joint singing, hearing little note of sung. है ना? You will understand, some song is coming, they start singing along with that. That is Kruka Sativam. The another thing is there. See, when something, some Gana chal raha hai, they start banging the table. Tak, tadaka, tak, tadaka, tak, tadaka, tak. Like that, they start banging the tabla. For that, it is the Crotalus horridus. No. Tarantula hispanica. Tarantula hispanica. No, you just see, if some child is coming to your house and they are some song it is is listening from far away. Then you start tak taka, then tabla bajane shuru kar dega. That means that is Tarantula hispanica. And here, if some tune is you are listening, they start singing along with that. That is Kruka Sativam. This is a minor thing, you observe and let them have a headache or migraine or stomach problem. They all get cured. And the second is the Netramur also. You can give the Netramur because the quick repentance after the, if anything, after the anger, the quick repentance also in the Netramur.
Sir,
Huh.
Should we ask the same person these all questions?
Yes, he will ask, means what they are telling, the same question, but people will answer in different way.
Okay.
One will tell this here, na, way B, C, D. So, one may voluntarily start singing.
Answer is okay, sir. So question, we have to ask the so many questions for one person.
One person, all the questions.
Okay, okay.
All the
That's
questions and many things, just it is the
yeah.
model questions.
The
You can
answer will be different according to the nature of the person.
Yeah, perfect.
Okay.
And the answer are classified according to the different concept. Concept
Okay.
means here we have already seen frivolous. The frivolous means negligent.
Okay.
So like that. In some cases, so I get very restless when next second answer. Suppose what we asked, have you आपको टीवी और म्यूजिक लगाने से कैसा लगता है? You asked, okay. The answer number one is I really love it. It is very good for me. And even sometime I start singing along with that. That time crocus sativa. Okay. When the second answer, someone tells, no, I get very restless while watching. Sir, I'm taking class. I will call you, sir, please. Huh? Okay. The second answer may be, I get very restless while watching TV, listening to song on the tape record deck stereo. I get irritated. I ask them to stop it. Anna. So how the answer we can convert into rubric called as a amusement aversion to. Amusement aversion to. Even I belongs to that category. If some I think so I should also take sulfur. Amusement means I will really not enjoy in the big parties and some so many birthday parties and so many other parties. There will be a lot of howling, crying, or you can say shouting, and though I will never enjoy that. So amusement aversion to. Really, I get far. No, not in the. I mean, music aggravation. I enjoy music, but music aggravates. Means that loud sound. I can't tolerate. Palpitation, palpitation on music, on listening to music. If such cases are there, okay. You see here, 2 plus me amusement aversion to, and what all F music aggravation, and L palpitation. If these things are these things are covered in with the patient, that time we should give the sulfur. Sulfur is a in homeopathy they use it as the master remedy. Because as per the Hahnemann, all disease generated, or you can say all disease born with the psoriatic miasm only. What is psora? We will tell. I think I'll request Dr. Suvarna to talk about miasms, but still I can't stop myself, so I'm telling that is that psora is believed to be, when we the broke break the when we have broken the law of nature. That time psora came. Psora came in the form of skin itch. Skin itch is the cheapest disease given by God. If after something, some internal disease is there, after that, after giving remedy, one gets the itching, that is a good sign of recovery. That is as per the classical homeopathy. Okay, na? So 2 plus E plus F. 2 plus E plus F. So F, E, amusement aversion to, music aggravate, and 2 plus 1. That is, what is 2? We'll just see. Yes. I repent letters after some time. He thinks that he repent after some time, quickly repent after some time, if in that case is there. Along with the E is amusement aversion to, and F is a music aggravation, that is ignitia. Ignitia is a very good remedy. And you what where ignitia is there in your combination? In your combination, shock combination and grief combination has got a ignitia. Ignitia, because it has come in the list, for that I'm telling you. Ignitia is a very, very good, for a grief. If someone near and dear has expired in the family and unable to get that courage, or you can say that grief is there. In such cases, ignitia works excellent. You must ask, when case taking, you should all ask the story. You don't ask whether your father died or alive. Don't ask. You say, tell something about your family. You should use the same word as tell something about your family members. Then he said, my father is that this, and he will tell you that my father was there and he is expired for since so many months and this one. Then you can ask what was his problem. So you can think about if anything related, that is a in the hereditary things, if anything is going to come, you can think of that. But ignitia, for that only, please remember, never forget to ask this question: is there anything happened in your family? Or you can say, how is it? Otherwise you tell something about your family. Anything wrong happened to you, in your family, you can ask, no problem. If that is yes, don't forget to give grief CM potency. In the grief CM, ignitia is already there. So I'm telling you now, we have finished 2 months. Well, I mean, last 1 month is only knowing, acquiring the skills of prescribing and something. That is only our main idea now. Okay. Next answer is, I don't get angry at all. If पूछा था ना हमने, the earlier the question was asked, are you getting angry? Then now the answer, fifth answer is, I don't get angry at all. Keep quiet and bear it. I never defy. I never say anything. तो ये भी तो उल्टा हो गया ना. हाँ, कुछ गुस्सा आना चाहिए. When you are disagree, you should get wild. No, the madness, that is called a mildness and yielding disposition. Yielding disposition मतलब उनका जैसे वो बोलता है वैसा ये मानने लगे. These are all this question and answer this will come in our next materia medica. Though you should remember, why do you remain quiet? Why do you remain quiet? So what is the use of it? It comes out of quarrel and it is only makes matter worse. It is better to be quiet. He will come. The same answer will come. अरे झगड़ने से क्या फायदा? Ultimately, matter will go worst. It is better to be quiet. Recognizes the reality and accept it. This is the catching word. For this is the cuculus indica. Cuculus indica, again about the medicine. If someone has got what you have to do, again go to this cuculus indica and see what is we are only talking about the mental level. You see what is the physical level it is helping, or it is creating. Both are same. Whatever it creates, that it's cures, as a law of cure, a law of like cure likes principle. So recognize the reality and accept it. If someone says like that, अगर आपको क्या गुस्सा आए तो क्या करते हैं? कुछ नहीं करता, और थोड़ा गुस्सा आएगा और थोड़ा लड़ाई झगड़ा होगा, क्या करना? Better to keep quiet. So if someone is telling, cuculus indicus is very, very good remedy for the cervical spondylosis, or you can say, or the no moving sickness, or you can say car sickness, or you can say traveling sickness, vomiting वगैरह होता है ना, तो उसको cuculus indicus is one of the most important remedy. What next? Answer 2. Dr. Saab, I am helpless. I am timid. I quarrel with a family member, but I am very good relation outside. है ना? ठीक है. So I am helpless. I am timid. I am quarrel with the family members, but I am very good relation to the outside. वो बोलता है कि बाहर क्यों नहीं झगड़ते हैं? घर में झगड़ा करते हैं लेकिन बाहर झगड़ा नहीं करते, because I have very good reputation. So How do you take these words in symptoms? Helpless feeling of, cowardice, quarrel aversion to, and strangled family from his being kind with the strangers, but not his entourage, entourage and his family. And if you come across such words, है ना, मैं घर में झगड़ा कर सकते हैं, because I am very good relation outside. So if anybody having such problem, it is common with the in our time it was a common among our children. They used to hate the family, and they used to, if aunt is there, uncle is there, or somebody is there, mama is there, they love them, anything like anything. Or neighbors, they become very good to them. And in such cases also we can think about the lycopodium. So now answer number 3. I don't have courage to say no, so I can't give my opinion. I am very, very, very angry, but I am unable to show it. If someone, अगर आपको गुस्सा आता है क्या, आप बोलने से so many answers, and one of the answer will definitely come from your patient. Helpless feeling of, बोलता है कि मैं, मेरे को उतना धैर्य नहीं है, आई डोंट हैव करेज. सो हेल्पलेस फीलिंग ऑफ, covered his opinion without courage to express his own, that is called as a petroleum, you know. So if the answer is I am unable to, I don't have the courage to say so, I can't give my opinion, and I get very anger, but I am able to show it. So the remedy, that symptoms are divided into these two, and medicine is petroleum, and petroleum is a very good remedy. What is petroleum jelly? When we all petroleum, it's a very easy thing. When we all apply petroleum jelly, Vaseline. Huh? Vaseline is nothing but a petroleum jelly. When we apply this in the cold winter, when in the cold winter, when there is a cracks on the skin, okay, dry, cracked heels or feet, we apply the petroleum.
To
Okay.
get moisturized.
Yes, we get moisture. For moisturizing, we can use the petroleum. So, but petroleum fellow, when you ask about the anger, they say, अरे भाई मेरे को झगड़ा करने का कोई मुझे इच्छा नहीं है. हाँ, like that बोलेगा. Very, I get very angry, but I am unable to show it. मैं दिखाता नहीं हूँ. I am not having that courage. You will tell. So that time, along with the match, the symptom match, you can give the petroleum. So next answer number 4. I am unable to express my anger. I start crying. I am ready. I am already all alone when they will ignore me completely. Even now they don't love me. If somebody, right. Okay, unable to express my anger, I start crying. I am already all alone when they will ignore me completely. Even now they don't love me. If somebody console me, loves me, show me sympathy, I like it. Yes, but who has got that time? Okay. So delusion neglected. See, Dhananjay ji, we come across such a problem, क्या बोलता है, patient very easily. We will come across such. I think so. I have not shared you, right?
No, sir.
Oh, sorry. Che, we missed a lot. I thought I am shared. Anyway, I have shared that book only. I thought you are seeing that that wordings I was thinking. Anyway, I have shared you the book, and all the answer number 4, that is answer number 4. I'm unable to express my anger. I start crying, So like that. Pulsatilla lady, we get very, very easily recognized. When that pulsatilla symptom is when they while telling the symptom, they start crying. Is the most important remedy is the pulsatilla. Why we have to, even though after having all Narayani mixtures, why we should study the single remedy? Because single remedy, they work very fast. Tuck, within no time it will work. So for that reason, pulsatilla, if some ladies come, they while telling the symptoms, they start crying, it is pulsatilla. And when about anger, if they tell, I will reply like that. I am unable to express my anger. I am start crying. Crying is a main theme of pulsatilla. कुछ भी हो जाए वो शुरू कर देते. They start crying. Then you can imagine, let it be any problem. Let it be a headache, or you can say menstrual problem or a stomach problem. While they are telling, they start crying, just give pulsatilla. This is what the technique of prescribing will be learning from here onwards. So here, what are what is selling? I am completely alone. Nobody cares me. Only everybody neglects me. Like that, so many things will be there. That is the time, pulsatilla is a remedy. These questions are already there. Sorry, I missed this. But anyway, this I have shared the book in that same sequence it is there. Okay. What do you do then? You ill. When you are become ill, then what to do? I want to be in my bed quietly. I don't complain much. Bed remain in desire to indifferent. Complaint does not. Indifference. Complaint does not. Means whenever they are having a problem, they should approach to the doctor or a friend or somebody, in the family, they should approach. नहीं जाता है वो बोला ठीक है वो जो भी है they will keep on sleeping. That is the hyosamus. One of the hyosamus is the one of the beautiful remedy for छोटा जीव जो गिर जाता है ಕಿರಿನಾಲಿಗೆ ಬೀಳೋದು ಅಂತ ಹೇಳ್ತೀವಿ ನಾವು that छोटा जीव जो नीचे आ जाता है that is a dry cough and irritating cough in the throat we get. For that also hyosamus is a very good remedy. Elongation of vulva. So that is the hyosamus. Hyosamus can be given for the छोटा जीव बढ़ जाएगा उसका जो भी और ಕಿರಿನಾಲಿಗೆ ಬೀಳೋದಕ್ಕೆ we can give this hyosamus. Along with that, because if somebody quietly, without asking anything, they are lying on the bed, just keep coughing, and they if they ask, they complain, do not, ಏನಿಲ್ಲ ಆರಾಮಾಗತ್ ಬಿಡ್ರಿ ನಾವು ಏನಿದಿಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. So will become all right, no problem. Like that they will be talking. That is a hyosamus. Okay, I want to remain in the bed and complain a lot. I want to remain in my bed and I complain a lot. Bed remains in desire to and lamenting sickness about his. ठीक है? In the opposite. बोलते हैं भाई क्या करेंगे? When you fight, I don't fight. So I remained in the bed and complain a lot. Here on the higher semis, there was a lot of there was no complaint at all. So, but here they complain about the sickness. They complain about the sickness that is the argentum nitricum. Argentum nitricum. And see, what was the answer? What do you do when you all are ill? You are ill, sorry. Then third answer is I don't have the strength to get up. I want stillness all around. There should be absolutely no noise. No one should disturb me. If someone is telling like that, stillness around, quiet want to be, disturbed aversion being, irritability spoken to when gelsemium. Now, the season is fever everywhere. Everywhere there is a viral fever going on. And one of the king remedy, important remedy for all sort of viral sort of fever, or even typhoid fever, and so many things, is the jalsemium. But jalsemium people will, how they will be, I don't have strength to get up. They are very, very weak. They become very weak, and they switch off all the lights. There are some symptoms I am adding from my side. They make a dark, whole room dark, and they sleep without, disturbed aversion. They don't want anybody's, disturbance. So in such cases, you can very well think, the another important symptom of gelsemium is thirstlessness. They will not drink water. No desire to drink water. And this is one of the most important remedy for the fever. Okay. So in this one, what will be the condition in that? They want to just lie down, switch off the light, and lie down. In such cases, gelsemium is one of the most important remedy. So what is the next answer? No one should disturb me when I am sick. Even I don't allow touch my bed. But if one talks about business, I will get up and say, let us discuss. This is what is a beautiful thing. Uh, That's a fantastic thing. It is very interesting. Dhananjay ji, this is very interesting. Kyunki, why I am telling you, anything discussing about the बिजनेस का कैसे बात करेंगे वो? दे विल आस्क व्हाट इज बिजनेस में क्या रहता है, लेन देन, हाउ मच यू गेट यू प्रॉफिट, हाउ मच यू लूज. दे विल कम एंड आस्क यू, धनंजय जी, हाउ मच यू पेड फॉर दिस मशीन, एंड हाउ मेनी पेशेंट्स यू आर गोइंग थ्रू, एंड हाउ मच यू आर गेनिंग, हाउ मच आपका प्रॉफिट होता है क्या? एंड लाइक दैट दे विल स्टार्ट टॉकिंग, even though they are having cough and cold. Very good for cough and cold, dry cough. Brianna is a wonderful thing. How you can see, you can go to CCA mixture number 71. All things are there in the Brianna is there. And speciality of that is disturbed aversion to being. They want to quietly lie down, and even someone, they don't want to even shake their bed also. Okay. And the another thing, fear of starvation, fear of poverty, and business talks of, no, they will be keep talking about these themes very fantastically. Fear of starvation, quite wants to be, because the movement aggravates them. And fear of poverty, business talks means like that only. They will tell you, sir, how many days I have to take. The another one, how many days I have to take, means they will be, they are very recovered to fastidious, means jaldi ठीक होना चाहते हैं. लेकिन another thing is, when you charge 1,000 rupees or the 500 rupees to them, after giving money, they will ask you, how many days I have to take this medicine, means how many days I have to give you the fees. In such way, then you can call them, bhai, you take a Brionia, give that Brionia, let it be anything, let it be a muscular pain, let anything it can be. Go through the materia medica and study the Brionia. It is one of the most important remedy for the rheumatic problem. So like that, what is the Briannia symptoms? They'll be talking about business. They will be thinking of fear of starvation, fear of poverty. The such situation is now there. Many people it is there because of AI introduction. Many people, they are afraid. अरे भाई क्या होगा, ऐसा होगा. They will come and talk to you. You just ask them, actually your consultation should be a very casual talk. But when they are talking casually, within that only you have to catch and try to fit them into a good remedy and give them, and so that it will cure all their problem. This technique is called as a SEHGAL method. And another method is there, that is also like that only. Plain talk, keep talking, and we will have to classify them into the kingdom and come to the remedy. Okay. Now, this is a most important remedy because many people come across the bryonia. In Gelsemium, rubrics are not present. In Gelsemium 3, 4, and 5. 3, 4, and 5. Business talks and that fear of starvation and fear of poverty will not be there. In such cases, you can give the Gelsemium. Answer number 5. He doesn't want to be disturbed, avoids seeing people and presence, prefers lie down with the closed eyes. He is indifferent to everyone around. Company aversion to, avoids the sight of people, lies with eyes closed, indifference to loved one. Eh? This is a fantastic thing. Okay. So CPI, we already last in our lecture, I covered about the CPI. CPI is that one of the the olden days it was used as a ink, and CPI is a fish ink. When it somebody try to catch it or this one, immediately it spreads the ink and escape from that place. That ink is taken for the olden day. They used to for the writing they used to use it. So that CPI, what symptom? If that CPI person is asked, what he will tell? He doesn't want to get disturbed. Avoid seeing people and prefer to lie down closed eyes. Indifferent to everyone who is around. Means you will just fight with everyone. Indifferent to loved one means that bache sometime you love your kids so much they try to come and disturb you, then you shout at them. Even your wife, generally the CPI is for women dominance, means not dominant women, it is a woman dominance, means frequently it is given to the women patient. So there the indifferent to love one, though they know that they love them so much, still they fight along with them. That is a CPR. So this is the way we keep on asking question until we reach at the medicine, and the whole materia medica can be completed in this way, and there is no end to the question. Various questions regarding the hope or despair of recovery arise, and squandering and company desire and company aversion, fear, anxiety, frivolous kinds and memory and forgetfulness, and many more things can be helpful for reaching at the similinum. Similinum, we all ask this question to find the similinum. Similinum means the similarity. They have given one more example, technique in children. So technique in children today, see, we are fortunate to have today in our class, our madam is there. She is a children specialist. Okay, and very, very experienced madam. So how to apply the technique in children? Does he throw things in anger? Anger throw things away. Does he break the toys? Break the destructive. How we can find out the symptoms, or you can say rubric in the with a child. Does he pull their hair and nail? No, like that. Does he pull others' hair? They will pull the hair, for others. That is a symptom. Does he pull his own hair? Does he keep his books, clothes neat, clean, in order? That is fastidious. Is he afraid of injection? Fear of injured being? Does he run away from the injection? Does not allow doctor to give? It's commonly सब लोग तो भाग जाते हैं. He is afraid of darkness. He is afraid of ghost at night. He is scared of going into the room. He is scared robbers or thieves? Does he strike his head on the wall, striking himself, knocking head against wall? Means these are all, you will tell, they will tell you what he does. Does he strike in anger, rage, and striking with? Is he dominating, dictatorial? Yes, dictatorial. Yeah. ನಮ್ದು ಕನ್ನಡ ಮೀಡಿಯಂ ಹಂಗಾಗಿ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್. ಸೊ he is estranged from the family and in a kind with the other stranger. है ना? Estranged family from his kind stranger, but not with the entouragers of this family. In he easy, loving, and affectionate in the easy, timid from the inside, but always talks of bravery, affection. Does the child like being cared with? Means कई लोग को प्यार करना अच्छा लगता है. So carried and cares, desire to be. Does the child become quiet when, because child can't tell you their symptom. This is how we have to take the symptom, because taking symptom from the child is very difficult. So likewise, you have to ask the parents, or you can say those they were along with them, then they will tell. Does the child be quiet when rocked? Rocking emulation. Tap chukku baded ante ಹೇಳೋರು ಅದು. When you're rocking, that is emulation. Rocking desire, aggravation. Some child will get up and goes away. Mind yielding, recognize easily and accept. So these are the question how we should ask according to the SEHGAL system. And now disease wise, remedy wise, we will see we saw what are the different answers, means what all those things, carries desire to be fast. We saw that belladonna was prescribed there. Smiling involuntarily. When talking to you, giving symptoms, they smile. It was no reason, they should smile. They should be very serious and keep telling. ನನಗೆ diabetes ಆಗ್ಬಿಟ್ಟಿದೆ, like that. I didn't take, I didn't bother so many days. Why you didn't take, there's no reason like that. When this all we saw in the previously. So calculating inability for, I think so I should take it. Sometime you also might be feeling हंसता क्यों है भाई? You is telling it is not हंसने का topic नहीं है, लेकिन हंस रहा है. ठीक है, I will also take that. Now well, now sick, means suddenly. In such cases, you can think, see, about belladonna, you can think about light desire for. Light desire for means what? Here there is entirely different nomenclature. Light desire means he wants some idea. A light means not the direct light only. He will some thoughts. If someone gives a thoughts, he will accept it. I means he wants some thoughts to tell, so that he will do the work. And his benevolence, unreliable in the promises, delusion, wealth of, naked want to be, superstitious. These are the main rubric. I will tell you, there is a very here. Naked want to be means not the physical, he without dress he want to be naked, nothing like that. Because in SEHGAL system, naked want to be means they should keep some secret with them, but that secrets also they are telling out easily. They want telling their pure secret which they are not supposed to disclose. If they are telling such secrets, you can think about the belladonna. That rubric is also called as a naked want to be. And this is also like in belladonna also it is like that. And another another remedy, that Hyosemas also like that only. Some secret they have to keep up about their family, or you can say they're for themselves. They should keep some secrets, and if they are which not supposed to be told to everyone, if those secrets if they are telling, then Sri Ramji समझना चाहिए वो okay, he want to be naked means वो होना चाहता है, तो he want to show off his the ugliness, तो उसको पक्का पकड़ के you can give higher summons or belladonna are the most important remedies. Okay, attention seeking, these are all the common thing, but most thing we have to see the catching guiding symptoms, or you can say. Okay, so please go through, there's a fantastic thing. Now they have given these many symptoms. Carry desire to be fast. What is according to the SEHGAL method, what does it mean? According to the SEHGAL method, what is the carried desire to be fast means what? Patient want immediate relief. He says homeopathy works very slow. That's why he has never opted it. He want some medicine which would give him instant relief. You will get many people like that. He will come to you, sir, ಏನು ಗೊತ್ತಿಲ್ಲ ಏನಾರ ಮಾಡಿ immediate ಆರಾಮ ಆಗೋಂಗ್ ಮಾಡಿ, immediate give me immediate relief, like that if they are telling, and they say they want some fastidious, I mean carried to be desired fast होना है, जल्दी होना है, कितना दिन, and they may ask you one more question, how many days my disease will become all right, how many days I have to take the remedy. That is also one of the way. And frivolous is not serious about his illness. I told we are given many examples. बाजार को आया था, देन शिवमोगा आया था, इसलिए सोचा श्री राम जी से मेडिसिन लेके आते हैं. नॉट हैविंग मीन्स वैसा नहीं होना चाहिए. आई वांटेड टू टेक मेडिसिन फ्रॉम यू, इसलिए आई कम टू शिवमोगा, वो अलग है. बट ही विल से वैसे ही शिवमोगा मेरा किसी का शादी था, फ्रेंड्स का इसमें ओपनिंग सेरेमनी था. Then I thought Sri Ram ji is a very good doctor. We will go to him. We will take a remedy. वो आया. Then you think that about a belladonna. Belladonna is a fantastic remedy. It has got a, why I am telling fantastic. It covers many areas it works. And superstitious. Superstitious means according to the SEHGAL method. I told you, according to SEHGAL method, superstition means just believing, no logic. He has no logic for thinking. He has solid reason for coming to you. He has no solid reason for coming to you. My friend has recovered, so I come to you. So like that, they will tell you. That means that is a superstitious. For that only, one of the most important remedy is the sulfur also. Light desire for. I told you, na? The light does not mean the light of electricity. Here it means the desire to know about the illness. Yes, this is I forgot to tell you. He will ask many questions about his disease. ನನಗೆ ಯಾಕೆ ಹಿಂಗಾಯ್ತು, what is I am suffering from? Actually, diabetes means what? For example, I am having this so and so. Prostate enlargement is there. Have you ever treated similar cases? Prostate इधर क्या होता है? If there can be a cancer also, like that, so many things. He want a light on that particular illness. Light desire for. That is there in the belladonna. Okay. Dr. Sahib, I am suffering from this. Will I recover? Is there any need to go to some X-ray, ECG, ultrasound, etc., which might help in diagnosing? He will tell you. He will tell you? I have a X-ray report and the blood report. I will send you. I will show you so that you can diagnose me properly. They will tell you like that. आप इसको देखो, उससे आपको और अच्छा आइडिया आ जाएगा. Then you can think that rubric is light desire for. So light desire for, you can prescribe the belladonna. Hide things, I desire to, a naked want to be. He is not always secretive. I told you, no, naked want to be, the meaning of this is he is not always secretive. He will try to hide his illness from some time. A patient of belladonna cannot hide long. He will soon tell. He will even show the disease portion also. There is a desire to escape from the direct confrontation with the illness. I have come across such a horrible patient. And because they, first of all, they will not tell you. First, initially, they will not tell you. After that, they will tell you and even torture you also, unless until they will show you. For example, some skin disease is there. Some skin disease is there. It is there in the inner part, somewhere inside. अरे हाँ भाई पता है, you have shown me everything, you have given me the symptom, I can give you the skin itch and skin D, okay, it is fine. They will not listen. No, sir, I will show you first, sir, then only I'll be happy. And they remove the pant and they show the places where there is a skin problem or any problem. They want you to give them a light. Huh? So they want, you should understand it better so that you can treat them better. So in such cases is a belladonna. Laughing while speaking, it is a common problem. Okay, I just told you. Naive, trust everyone without making any enquiries. है ना? So he बोला कि yes, my friend told he became all right. So I have come to you, he will tell. Then see, he has not tried to understand what disease he was having, how you cured, how many days it cured, but he has come to you. है ना? Follows everyone, willing to believe easily. Unreliable in the promises. He never keeps the promises. You asked him, take the precaution and not to eat particular thing. This is common thing. You know, sugar नहीं खाने का. Then वो बोलेगा, then next time आपने sugar खाया? नहीं sir, sugar तो नहीं खाया, वो taken some jaggery. Means they have taken jaggery, like that they will tell. So means they will not keep up their promises for their own health. है ना? So what they tell, he did not take, but when admits laughingly that he couldn't control, है ना? Same thing happens with we say don't take non-vegetarian नहीं लेना चाहिए आपको. Then वो बोलेगा I could not control. I don't know what is there in that, in not having control. I could not, Dr. Saab, मैंने ले लिया. I took that. So they will tell in that way. Objective, reasonable. They will give solid reason for coming to a doctor. If he preserves or stops taking medicine, he gives a reason. He says, I cured of the same problem earlier. Now it will be cured. For every condition has some reasoning. Means why he has come to you? Because you cured him in once last time. Benevolence and kind, helpful. See, how do you understand this? Because in our so many years, because I started practicing in 1987 in Air Force, evening every 6 to 9 I was practicing. So I know so many sentences have come like that. So kind and helpful. Benevolence means he will tell you, sir, if you cure my medicine, I will give you, I will give you 10 times of this consultation fees. I will give you 1 lakh rupees. Or I can say, I will send you many patients. They will tell you. There are all many friends are waiting for me. When I am becoming all right, I will send all of them to you. That is called as a benevolence. Anna? So in such cases also you can think about belladonna. Okay. Few types of belladonna patient. Dr. Sahab, I have the problem. Somebody told me today or last evening that I decided immediately come to you. And yes, we have already, we saw that, and he will say, is there any need to go for blood test, urine test? And this one, my friend told me that you have cured him, and laughs. So this is a complete story of belladonna. Belladonna person will talk like this, and you can give the belladonna. Dr. Saib, this is my problem. Few days ago, my friend told me I am careless. Ha ha ha. And he has been cured by you. I think so. You will get. I will also get well. And no, though his friend was suffering from some other illness, even today my life compelled me to take the medicine. Means वो खुद की मर्जी से नहीं आया. So like that. I was just or you can say I was just passing through. I had come to the city and I thought taking medicine is too, I will be cured. So is there any need to go to some test and diagnosis illness like that? Huh? So like that, if some person comes to some situation, that is the belladonna. Okay. Shall we go to the next? Hide stings. We already covered this. So Cuculus indica. We are already gone. What is the See, you should always use this kingpin of the Cuculus indica, like a keynote. In every homeopathic remedy has got a keynote. Likewise, Cuculus indica is recognize the reality and accept it. Actually, rubrically recognize everything but cannot move. Or that MS SEHGAL has changed the recognize reality and accept it. This means that patient recognize the reality and accept this. He compromises without any regret and grudges. This is the focus of Cuculus indica. If you notice his sign, the case never fail. If the case of Cuculus, even 100 doctors would select the same medicine. Recognizes the reality and accept it. You say, oh, I have not followed your instruction. I recognized it. For that only it has happened to me. Like that they will tell you. The patient accept the reality and he feel anger. If he anger is never says anything wrong to anyone because he thinks silence is golden. And what cannot be cured must be endured. Ah, that is a fantastic thing. We see many people, many the patients suffer from the cervical spondylitis and they live with that. Then live with that. They say that, yes, I am suffering from this. It can't be helped anymore. And they recognize reality, accept it. So they don't take any remedy. Have you taken, they maybe put the collar for then it is paining. So in such cases, the Cuculus indica wonderfully helps in the spondylitis also. What they are telling, what cannot be cured must be endured. हाँ, जो ठीक नहीं हो सकता उसको झेलना पड़ेगा. They will tell like that. You will ask if joint pain कैसा है भाई, क्या how is your joint pain? डॉक्टर साहब नहीं, अभी ओल्ड एज हो गया ना, हमको झेलना ही पड़ेगा. If they tell like this, you have to select the Cuculus indicus. If someone just by talking to you, you ask them, how is your knee joint pain now? क्या डॉक्टर साहब, हमको तो झेलना ही पड़ेगा, एज हो गया ना, वो ड्राई हुआ रहता है, अंदर साइनोइड फ्लूइड कम हुआ रहता है या बोन घिसा हुआ रहता है, तो वी हैव टू एक्सेप्ट इट लाइक दैट. अगर किसी बोलेगा देन यू शुड give the Cuculus indicus. The patient believes that he cannot be cured, he must be endured. You will get many patients like this. Means they will undergo the problem and they accept it, they don't, and they accept it and they want to endure it. If for such case patient, you can give the Cuculus indica. The way how we have to follow this book, we will tell. Then you and in between also we will tell some of the Okay, this is a very, very excellent thing. Opium. Opium है ना, अफीम, you know, अफीम is a drug. But in homeopathy, they mainly based on toxicology. What all toxic thing it has produced on us, on it all, what all the toxic thing it has produced on us, with that only remedies are made. With that only medicines are made, and based on that, actually, if afim, if it is taken in more in quantity, then what happens? One goes into the coma like stage. Overdose हो जाएगा तो क्या होगा? Goes into the coma like stage. When a body suffers from like anesthetic like thing, they don't recognize what is happening, what is touching, and somebody list or sound, or you can say touch. For such thing in homeopathy it is used. But how to in SEHGAL method? In SEHGAL method, when we are to give this SEHGAL method, opium, when someone start talking to you and fear extravagance in excess of what one's own estimation, and is a right limit scared to cross a limit, and they have in their mind, means he will not take medicine many days, but he will come when problem increases. For some days he will remain indifferent to suffering. Yes, you can think about this. We get a sufficient patient like this, है ना? आपने medicine दिया, they will not take, will only take for few days, and they will again after 1 month and come back to you, and they will come with that dropper bottle. बोला आधा खत्म है, आधा लिया ही नहीं. बोला आपने क्यों नहीं लिया भाई? नहीं नहीं, मैं हुआ था, आई फेल्ट समथिंग बेटर, सो आई स्टॉप द मेडिसिन. अगेन इट हैज कम नाउ, you give me the remedy. Like that they will come. So what is the theme of that? Indifferent suffering too. Indifferent suffering too means when the problem is increases, they come back. Otherwise, they don't take medicine. Such people, you can give the opium. And also, अगर जब सो जाएगा ना, it is very difficult to get them up. तो अफीम जो लेता है, लिया हुआ बंदे को क्या होता है? कुछ कितना भी उसको हिला डुला हुआ जागता नहीं है. सच सिचुएशन इफ इट इज हैपनिंग टू ए पेशेंट, कोई बोलेगा एक बार सो जाएगा ना, कुंभकर्ण के जैसे, उसको उठाने का बहुत मुश्किल है. देन थिंक अबाउट द ओपीएम. ओके. Next is Hyosamus. See, kingpin of the Hyosamus, fear betrayed of being. See, in the modern days, how can we give this remedy? Hyosamus is one of the most important remedy for all the mind issues, mind related issues. Hyosamus is also a desire to be undressing desire, like that. So many things are there in Hyosamus also. This is a पागलपन का लिए chief remedy है. And इसका main theme है being betrayed of being. Main theme is that मेरे को सब लोग मेरे को बिट्रॉयड कर रहे हैं, यानी मोसा, आई मीन दे आर डिसीविंग मी. ये कॉन्सेप्ट, मेरे पैसा ले करके आप लोग मजा कर रहे हो. आप मेरा पैसे, आपको मेरे से पैसे लूट रहे हो. यू आर डिसीविंग मी. धोखा दे रहे हो. बिट्रेयल करेक्ट वर्ड है, धोखा. फियर ऑफ धोखा हो रहा है. और कई पीपल विल कम एंड दे विल कम एंड टेल यू दैट इसका मेन है ना आजकल ब्लैक मैजिक. दे विल कम टू यू, सर आई हैव बीन ब्लैक मैजिक हो रहा है मेरे ऊपर. हाँ जी.
બધી છે ડામણા
Okay. The highest MS main theme is they are betrayed of being. मतलब क्योंकि आजकल आपको पता है दे पीपल विल कम टू यू दैट ना मेरे ऊपर ब्लैक मैजिक किया है. मैं ब्लैक मैजिक कौन किया करके आते हैं पता है. हस्बैंड को वाइफ किया हुआ करके बोलते हैं बच्चे को. मतलब दो उनकी जिसके ऊपर बहुत ज्यादा ट्रस्ट होना चाहिए वही वही उन्हीं के अगेंस्ट में कंप्लेंट रहता है उनको. मेरा जो ब्रदर का सिस्टर ब्रदर है वो है ही नॉट टॉलरेटिंग मी लाइक दैट सो मेनी स्टोरीज दे विल टेल यू. सो आई फ्रॉम माय साइड सी इफ समवन कम्स यू दैट आई हैव बीन ब्लैक मैजिक हुआ है हमारे ऊपर गिव द हायोसमस. He has feared to lose everything he wants. So, fear of being betrayed. That is a hyosamus. हमारे को पैसा ले करके पूरा हमको धोखा दे देंगे. Like that. और आपको भी बोलेंगे वो मेरे को हॉस्पिटल में गया. आई स्पेंड अराउंड 1 लाख रुपीज और 10 लाख रुपीज. मेरे को कुछ नहीं हुआ था. दे टेकन हमको धोखा दे दिया उन्होंने. झूठ मूठ का पैसा ले लिया. लाइक दैट दे विल कम एंड टेल यू द स्टोरी. Beautiful है something affection. These are all what are how people will talk to you. Means when they're talking you should catch these words. क्या बोल रहा है ये तभी पता चलेगा when you keep on reading such things. Keep on reading. ये तो बहुत छोटा बुक है वो. I started with this because it is easy to catch. You will come across few you know few questionnaires will come to you directly. I told you when Hyosamus reveals the secret. So decade want to be means tell truth tells plainly. Reveals the secret. वो नहीं होना चाहिए. Some secrets should be maintained. अगर वो करता है तो Hyosamus is a remedy. Very good. ये सारे पागलपन का ही रेमेडीज है. What is stramonium? How many of you have seen the stramonium? आपका गांव में स्टेमोनियम देखा है. दतूरा स्टेमोनियम. Because in the roadside in the wherever there is a that some weeds are there that time शिव जी के लिए बहुत प्रिय करके बोलते हैं इसको. That is a thorny fruit. You will get and a big white flowers. It is called as a datura. Stramonium datura. This is the one of the what is the main rubric of this? Clinging to person or furniture too. Clinging means वो पकड़ के बैठेगा वो. And sometimes they're like that only. There are two friends, two or you can say even maybe female or male. They can be so good friend. वो सोचेगा अगर वो अदर फ्रेंड चला जाएगा तो मेरा पूरा सत्यानाश हो गया. आई कांट सर्वाइव ऐसा बोलेगा. दैट इज कॉल्ड एज अ क्लिंजिंग एंड पर्सन टू द और फर्नीचर. वो पक्का एक जगह में बैठेगा तो वो हिलेगा नहीं जनरली. एंड क्लिंजिंग चाइल्ड वेकन्स टेरिफाइड एंड knows no one, screams and clinges to their near one. Yeah, ये clinges is like that only. ये कोई भी एकदम कुछ ये it happens naturally and in picture also. कहीं पे that is a thunderbolt आया डांग करके. In the rain you get a thunderbolt. When the thunderbolt down करके sound आएगा a child will go and grabs its mother or brother or whoever is there in the nearby. If such things happening, such things you are noticing, that is symptom of stramonium. Stramonium, one more thing is, they are bright light, they will not be able to tolerate. Because why this book is, books contains only few remedies, and you have to fit your patient will be one of this remedy, not from out of this book. All will come inside these remedies only. We have to fit according, because this is mainly on the mind symptom. For that only SEHGAL system is very easy. Keep reading so that you will come to know. Frightened, weakened, terrified, no one screams, clinges to the near one. If such things happening, you can give this. Indifferent, complaint, does not. Yeah, indifferent. He will be having so many problems, but he will not tell you. Indifference to suffering. Helplessness, feeling of fear, injured of being. So many elder in a case, patient about 60 of age said, whom to complain? There is no one to listen to me. The children don't care. All the three sons have been separated. So I never complain. If I do, they will get angry. And it's a cry of helplessness. If it is a common situation nowadays in our society. And common answer is, ಯಾರಿಗೆ ಹೇಳಿದ್ರಿ, ಯಾರು ಹೇಳಿ, ಎಲ್ಲ ನಾವು ದರ್ ಇಸ್ ನೋ, ನಮ್ಮ ಮಾತು ಕೇಳೋರೆ ಯಾರಿಲ್ಲ, ಎಲ್ಲ ಮಕ್ಕಳು ಬೇರೆ ಆಗ್ಬಿಟ್ಟಾರೆ. ಆಲ್ ಚಿಲ್ಡ್ರನ್ಸ್ ಆರ್ ಸಪರೇಟೆಡ್. No one will, if I never complain, if I do, they will get angry. So like that, if someone tells you, you think that inside the stramonium bhuta is talking. Stramonium medicine is talking, and you prescribe stramonium, they will become all right. Wherever DD, in this book, DD is given. DD means differential diagnosis. Means what else can be. Many places you will find that is a DD. DD means differential diagnosis. In Hyosamus, what is does? He has fear of injection, fear injured being, but not the darkness. Where in stramonium, there is both fear of injection and darkness. How this is separate as compared to how the stramonium separate compared to the Hyosamus. Hyosamus में नाइट का fear नहीं रहता. In this one, stramonium has a both fear of injection and the darkness. Okay, DD means again the differentiator. What is the difference? This thing. Meaning of the rubric. I have been suffering for last 15 to 20 days. Though I couldn't get well on my own, I knew of this pain, but he was apathetic. Okay, I mean, that is indifference. Indifference means is not a natural thing. Naturally, if suffering, you should tell. Like that, mujhe pata hai, I'm suffering. Okay, I didn't take a remedy. I didn't take a medicine. Okay, so like this. In differential diagnosis, Hyosamus, what it is just compared, so that the similar symptom you come across, and there itself you will be easily able to diagnose, able to identify. Belladonna, laughingly he will say, okay, inject me. When you use the stethoscope, he will keep on giggling and laughing. So that is the thing. Laughing is a big problem in the belladonna. Cuculus indica. Okay. So in children. So please go through this, because I just want to introduce this system, and wherever in case of any doubt, we will take that, because I will show you the path. That is, you have to walk into this path. है ना? So like that. There are so many things, and there are not many remedies here. I think maximum 25 to 35. I will tell you one more distance. Huh? So we just saw that sulfur. I will take one more good remedy, because there are so many common features in the sulfur. Kurkas sativum we have already talked about. I will tell about arsenic alpha. I don't know whether when we are going to get ignitia. Ignitia I already talked about. What is the ignitia? It is best remedy for any grief. Ignitia is on the top. Courageous approaches by the person being. Okay, you can go through, because it is generally, most of the doctors come under the sulfur patient, at least in my home. So sulfur patient means they spread the things across. In the table, they don't keep it neatly. Because they find it is very easily accessible. Very easily they can pick up the things. So they want keep according to their requirement. Okay. So when a person comes to you, and start arranging your table, or one bottle, I think it is lying down, one bottle here and there, what they do, they keep that bottle straight, and they arrange your table, and in other way, till the time they are arranging some of their items in a proper place, they don't get sleep. So that is called as that is a arsenic symptom. I came across, because many things, I purposely, or you can say it is happened. So on the table, it will be lying down. One bottle will be in a zigzag way. It will be there. The patient will come and start arranging it in a systematic way. Then I will listen to them. And then I'll give only the arsenic alba and send them. Because arsenic alba is a polycust remedy. It covers many symptoms, many symptoms. So his mind, when we say that he is fastidious, then we give him arsenic alba. I was just searching arsenic alba. Okay. So we'll just see the Bryonia. Bryonia is very important remedy. How Bryonia patient will talk to you. Doctor Sahib, get me well, otherwise I won't be able to go for work. I am worried about my future. They will tell you like that only. You make me all right soon, so that I have to go to the work. Otherwise, because how many days they give us the leave. So please make me as early as possible. Get me cure, or make me all right. Fear of poverty, being starvation in industrious mania for work. If I remain unwell, I will run out of money, from where I will be able to feed my family, and like that they will talk. We already talked, because fear of poverty and fear of starvation. Okay, and the business talks. Business talks, what he talks, let us see. But he is happy someone talks about the business. Suppose his wife tells him that there was a call from his office regarding business. He will readily talk and give long instruction to the staff. so as not to make a mistake. While talking, he will completely forget about his illness. But if some friend and relative comes to meet him, then he will ask his wife to tell them that he is not at home or he is sleeping. Okay. So business talks means like that only. So I'm searching for the arsenic alba so that whatever I was talking, it is covered there. You can see it. Very good book. Very recently, it came to me because I have a hard copy. It is not searchable. Otherwise, I would have searched. Yeah. Arsenic alba. Rest cannot until things are in proper place. Anxiety duty as if he has not done his. So fastidious. Fastidious means neat and clean. एकदम प्रेस किया हुआ कपड़ा पहनता है every day he should be neat and clean. So you maybe sometimes in nicely shaved and dressed, and like that the person will be, and rest until things are not in proper place. I told you he will come and sit, he will start arranging your table. So that means that no, he want everything in proper place. So just give arsenic alba. Arsenic alba is also a polycrest. Polycrest is a remedy is that which has works very, very broadband. Even from the skin to mind, everything it works. And it is arsenic alba is one of the important remedy in the corona also. They are given it for as a preventive. Okay. So now let us end. I think it is too late. So like this, you have to properly go through this book, and next we will discuss the next on sun our what do you call